wanted to talk a little about dementia. Like heart disease, dementia is a condition where there is excessive testing and unproven treatment because people do not know what else to do, and the system will pay for all of that. Dementia is a horrible condition. I take care of a lot of people with dementia. Their families are devastated. The patients themselves decline. Nobody knows what causes it, and there's really no good way to treat it. But there's an entire industry that has cropped up that tries to tell people that there are things we can do about dementia. Medicare will pay for that industry. This includes excessive testing and specialty visits and treatments, all of which Medicare will pay for, none of which has been proven to be very useful. For instance, people like to get tested to see if there's another form of dementia they might have. Maybe it's not Alzheimer's disease. Maybe they have some kind of problem within their brain that could be treated. Maybe it's a deficiency of a vitamin or a lab abnormality. So usually in a primary care office, we'll run some tests. We'll do a CAT scan, we'll do some blood tests, just to show that there's nothing else going on. Studies show that of 1,000 people who are tested for dementia, only 3 of them are found to have some kind of cause that is treatable. That is 0.3% of people actually succeed from this testing in finding a different cause. All the other people have dementia. However, people are not satisfied with that, so they'll go to see a neurologist who will repeat the test and do other tests. And usually they're not satisfied with that, so they'll go to a super specialist at a major medical center and get more tests, sometimes the same test, multiple MRIs. Medicare pays for all of that. Unfortunately, this quest for finding an elusive treatment and cure only stresses out people with dementia and makes them worse. It doesn't help them at all. What really helps people with dementia is to do an exercise program, to get some help from home health aides, to have spousal support, to go to home daycare. Medicare pays for none of that. What we know works, Medicare will not pay for. Even if dementia is diagnosed, there's no treatment for it. The drugs that are out there now are ineffective. Most of them have not been studied for more than a year because we think that after a year they completely don't work. None of them actually reverse the disease. If anything, they help symptoms a very little bit for a very short period of time. And yet when these people go to see specialists and super specialists, they're put on 1 drug and 2 drugs, multiple drugs. They keep going back and back, hoping that these drugs will help them, which they don't. There's an extremely strong placebo effect from these drugs. So the entire dementia industry, which is thriving right now, is based on falsehood that is paid for by Medicare and ultimately encouraged by the payment system. What we know works is not paid for. This is part of the problem when a medical insurance pays for excessive testing and treatment that doesn't work and does not pay for what does work. And this is endemic to our entire medical system.